What if the root of many modern diseases was something silent, hidden, and constantly smoldering inside your body? That's the reality of chronic inflammation, a slow, persistent process that can quietly damage organs, disrupt systems, and set the stage for everything from arthritis to heart disease, diabetes, and even cancer. In this video, we'll break down what chronic inflammation is, how it affects your body, what causes it, and most importantly, what you can do to reduce it naturally. Let's start with the basics. What is inflammation? Inflammation is your body's natural defense mechanism. When you get a cut, sprain an ankle, or fight off an infection, your immune system responds by triggering inflammation. This acute inflammation is helpful. It isolates the problem, sends white blood cells to the area, and helps the body heal. But there's another kind, chronic inflammation. That's where the problem begins. What is chronic inflammation? Chronic inflammation is a low-grade, long-term immune response that doesn't go away. It lingers silently in the body, sometimes for months or even years. Unlike a swollen ankle or a fever, chronic inflammation can be invisible, but it's still doing damage behind the scenes. Over time, this constant immune activation can start attacking healthy tissues and organs, and that's when chronic diseases start to appear. Let's talk about how chronic inflammation affects different parts of the body. Heart. Chronic inflammation can damage the lining of blood vessels, encouraging plaque buildup and leading to atherosclerosis. This increases your risk of heart attacks and strokes. Brain. Inflammation in the brain has been linked to depression, anxiety, and neurodegenerative diseases like Alzheimer's and Parkinson's. Joints. In autoimmune diseases like rheumatoid arthritis, the immune system attacks joint tissue, leading to swelling, stiffness, and pain. Chronic inflammation can wear down cartilage and bone. Lungs. Inflammatory conditions like asthma and chronic obstructive pulmonary disease, COPD, can restrict airways and damage lung tissue over time. Digestive system. Conditions like Crohn's disease, ulcerative colitis, and irritable bowel syndrome involve chronic inflammation in the gut, causing pain, diarrhea, and nutrient malabsorption. Skin. Inflammation plays a major role in skin conditions like eczema, psoriasis, and acne. These are external signs of internal immune system activity. Pancreas and blood sugar. Chronic inflammation is associated with insulin resistance, a key driver of type 2 diabetes. It disrupts the body's ability to regulate blood sugar. Immune system. Ironically, chronic inflammation can weaken the immune system over time, making you more vulnerable to infections and slowing your ability to recover from illness. Now you might be wondering, what causes chronic inflammation in the first place? Here are some common triggers. Poor diet. Highly processed foods, excess sugar, refined carbs, trans fats, and omega-6 heavy oils can all promote inflammation. A lack of fiber, fruits, vegetables, and healthy fats can make things worse. Chronic stress. Ongoing psychological stress can keep your body in a state of fight or flight, flooding your system with hormones that promote inflammation. Environmental toxins. Pollution, pesticides, heavy metals, and chemicals in everyday products can contribute to oxidative stress and inflammation. Infections. Certain viral or bacterial infections can cause long-term immune activation, even after the initial illness has passed. Obesity. Fat cells, especially around the abdomen, release pro-inflammatory chemicals that fuel inflammation. Sedentary lifestyle. A lack of regular movement slows circulation and may worsen inflammation. Poor sleep. Chronic sleep deprivation disrupts the body's recovery processes and increases inflammatory markers. Smoking and alcohol. Both smoking and excessive alcohol intake are strongly linked to increased inflammation throughout the body. Now that you understand what causes chronic inflammation and how it affects the body, let's focus on what you can do to reduce it. Here are 10 science-backed strategies to reduce chronic inflammation naturally. Eat an anti-inflammatory diet. Fill your plate with colorful fruits and vegetables, fatty fish, whole grains, nuts, seeds, legumes, and herbs like turmeric and ginger. These foods contain antioxidants and phytonutrients that calm inflammation. Limit processed foods, sugary snacks, refined grains, red meat, and inflammatory oils like corn or soybean oil. Choose healthy fats. Focus on omega-3 fatty acids found in salmon, sardines, chia seeds, flax seeds, and walnuts. These help reduce inflammatory responses. Avoid trans fats and limit saturated fats from processed or fried foods. Move your body. Regular exercise is one of the most powerful tools to reduce inflammation. Aim for at least 30 minutes of moderate activity most days of the week. Walking, cycling, swimming, yoga, and strength training all help lower inflammation levels over time. Manage stress. Chronic stress fuels inflammation. Incorporate relaxation techniques like deep breathing, meditation, journaling, and time in nature. Even a few minutes of focused breathing can lower stress hormones and calm the immune system. Get good sleep. Aim for 7 to 9 hours of quality sleep each night. Create a calm evening routine. Avoid screens before bed and keep your bedroom dark and cool. Lack of sleep increases inflammatory markers and weakens your body's ability to recover. Stay hydrated. Drinking enough water supports cellular function and helps flush out toxins. Dehydration can make inflammation worse. Aim for at least 8 glasses of water per day or more if you're active or in a hot environment. Avoid inflammatory habits. Quit smoking and limit alcohol. Both are well-established sources of chronic inflammation and damage nearly every organ in the body. Support your gut health. Your gut is home to trillions of bacteria that influence inflammation. Feed them with fiber-rich foods, fermented foods like yogurt, sauerkraut, or kimchi, and consider a probiotic if needed. A healthy gut helps regulate immune responses and prevents inflammation from getting out of control. Maintain a healthy weight. Losing excess fat, especially around the abdomen, can reduce levels of inflammatory chemicals in the body. Focus on sustainable lifestyle changes rather than crash diets. Even modest weight loss can make a difference. Consider supplements. Certain supplements have been shown to reduce inflammation. These include turmeric, omega-3 fatty acids, vitamin D, magnesium, and green tea extract. Always consult with a healthcare provider before starting new supplements. Let's recap. Chronic inflammation is a hidden threat that slowly wears down your body's systems. It's been linked to nearly every major modern illness, from arthritis and heart disease to depression and cancer. The good news is that you have more control than you might think. By adopting anti-inflammatory habits like eating a whole food diet, exercising regularly, managing stress, and getting enough sleep, you can reduce inflammation naturally and support long-term health. Think of inflammation as a fire in your body. You can either feed it or put it out. Every meal, every habit, every decision matters. Thanks for watching. If you found this video helpful, give it a like and hit that subscribe button for more science-backed health content. Let us know in the comments, which anti-inflammatory tip are you going to try first? Until next time, stay well and take care of your body from the inside out.